Hi guys, welcome back to the mental health quarters. I hope you enjoyed my previous video, which was an open letter to psychiatrists. Today I'll be doing an open letter to mental health nurses, and if you haven't watched that video, please check it out. There's so much to learn, and if you've been curious about what really goes on in during appointments, I think you'll learn a thing or two there. If you hear any thunder in my background, please pardon me. Nature has had its way today. It's been raining like throughout, I think, the ending of May, and it's entering June, and the weather is just, I like it. I think it's just a sign to show that God is good and nature is beautiful. So let's just get started. So a mental health nurse is someone, it can be a man or a woman, a lady or a guy, who has been trained and specializes in taking care of people with mental health conditions. Over my 8-year journey and road to recovery living with bipolar disorder, I have come across different types of mental health nurses, some interesting, some way, some the best, some excellent. And I've also listened to stories of my friends share their personal experiences with the nurses that they've worked with. This video is not going to bash any nurse, but it's just an opportunity for people to learn and know how it also feels like to be a patient or a client on the other side. So I really believe, and I know a lot of people agree with me, that the healthcare system will break down if there were no nurses. Like, nurses are very vital in the hospital. They do a lot of work, sometimes even the most unpleasant work and the dirty work. Personally, I don't think I could ever be a nurse, because I feel like I'm not saying I'm not a patient person, but the kind of work they have to do, I just feel it requires a whole lot of patience, care, and all that. They do so much, and I really appreciate every nurse out there who is like doing so much to just make sure that their patients recover. And this actually reminds me of a story. Some years ago, I was really fed up and tired of going for review appointments. I was just sick and tired of the fact that it had to be in my schedule that every week or every 2 weeks I got to the hospital. I began to resent the hospital. I began to resent my appointment card. I resented my doctors. So one time I went to the hospital, as angry as I was. The nurse who was usually at the OPD is a guy. He saw that I was upset, and he came to talk to me, and he asked me what's going on with me and all that. And that nurse, I really love him, because when you look good, like, it's just me. When I went to the hospital, I make sure I look good so that they know that I'm actually getting better every day. So every time he compliments me and all that, he's very professional to know, like, I love you or anything. It's just professional. I come, you do your professional work, I'm gone. He's not those flirty perverts kind of people, no. So he saw that I was upset, and then I told him I was really just sick and tired of coming to the hospital. Like, why does that have to be my life? So he encouraged me that was part of my monitoring my process and my progress. And I felt like he was deceiving me, like the hospital was just trying to make money out of me and all that. And he was explaining to me that no, it's to my benefit. So now when we meet at the hospital, it's just all smiles and all laughs. And I look back and I'm like, I'm just glad he spoke to me, and I'm just glad that he's always there at the OPD, even though now I meet other nurses. Because of that goodness he showed to me, it makes me have a good perception about other nurses and all that. And even sometimes when a nurse wrongs me, I don't take it, I don't generalize it, I don't say, oh, nurses are bad. I just know that just because somebody doesn't treat me, a nurse doesn't treat me right, doesn't make all nurses bad. And I wouldn't be where I am today had it not been for their help. It was a collaborative effort. My psychologist did their part, my psychiatrist did their part, I also did my part, mental health nurses did their part. But there are some recommendations I would like to make to mental health nurses worldwide. It doesn't matter if you're in my country or outside the country. I know this video, whatever I'm going to say, will apply to all nurses, maybe not only mental health nurses. Dear mental health nurse, so do discuss my mental health condition with me. With me. Emphasis on me. So what usually happens is that the nurses are one of the first people you would encounter when you go to the hospital for any even a regular hospital. Nurses are one of the first people you come into contact with. And if you are like me, who has been having a mental health condition or been living with a mental health condition like bipolar disorder or any mental health condition in general, you do get to meet the nurses quite often, and you do get to be friends with them or develop some kinds of relationship with them. But sometimes what also happens is that they do not really discuss your mental health condition with you, in the sense that, so I'll use myself as an example. It got to a time in my personal journey, my mental health journey and my road to recovery, where nurses would just like check my vitals, my temperature, my blood pressure, my weight. Unfortunately, if you do not ask the nurse the specific details about, oh, how much do I weigh now, or what's my blood pressure now, you may never find out that information because they do not disclose that till you ask. Personally, I always make sure I find out that information from the nurse who checks my vitals, because they are putting that information into my folder and I would like to know my body, my rights. And just tell me when I'm coming back to the hospital again for my review appointment. It was like they do, I do. There was no kind of communication or relationship, or like sometimes it was very like, it's like maybe sometimes you feel like maybe they are just burdened with their work, or they are not happy, or you feel like maybe you are probably a nuisance with them. And I'm not going to lie, like I said, I've not always been the best patient, but to me, I feel like sometimes a nurse who has been trained should also take time to speak with patients. And like I said in my previous video last week, sometimes doctors, if you don't speak with them, they wouldn't tell you what's going on with you. And nurses actually spend time with patients. For example, when you're on admission, the nurses are the ones who are there with you most of the time before the doctor comes. And I remember on one of my last admissions at the ward, the nurses were one of my not favorite people. Like, they don't talk with me. Like, it was just like, I give you your food, I give you your medicine, that's it. No form of communication. They are just going about their business. And their excuse most of the time would be that they are busy or they are burdened or whatever. But I feel like nurses who go to school to learn about mental health conditions, they know so much, but they don't really talk about like it with you or share with you. And it's a challenge because, like I said, we work with different cadres of people, and when such a group like nurses, who are usually the first people you can't come into contact with most of the time, don't even want to share or talk with you. Sometimes you feel like you are on your road to recovery alone. It's just you are just going to suffer and you're just going to be burdened and all that. So now it begins to feel very lonely and very more difficult to recover. And this success on anybody's road to recovery is always collaborative effort. So I would want to encourage every nurse out there that yes, I know you have duties, you have responsibilities, but sometimes go out of your way to just speak with a patient or client or talk to them about their condition. You never know what somebody is going through, because when you do not discuss, it begins to feel as if you are just there for the job, just there for the money. I don't really matter to you. Yes, you are there for the money, but I do believe you had a passion and a reason why you decided to choose the nursing field. And one of my, like, a nurse who really made an impact on my life, I would like to give a huge shout out to Nurse Robert. He was someone that I remember when I was on admission at the first time at the hospital and I got discharged. He was a community mental health nurse. He made sure to come and visit me at home, which was not for free though. But he came to visit me at home, followed up on me, checked up on me. And Nurse Robert was someone that anytime I called him, he was always willing to discuss my condition with me, whatever I needed, whatever help. No matter how angry I am about the treatment process or whatever, he was always there to listen. Dear mental health nurses, offer compassion when patients or clients need it at a difficult time. I cannot state how important this is. So, most of you know that nurses are supposed to be caring, loving, empathetic, and all that. But sometimes when you are doing a job as difficult as nursing and as time consuming, energy draining, there's a high tendency that you probably forget or will not want to offer help to a patient at a difficult time. So I have been in a situation where, like, I was on admission, I was upset, I was pissed, I didn't like the fact that I was kept in that environment for about more than 5 days. And whenever I voice out my complaints about something I do not like, the nurses start making it look like, oh, you are a problem patient or a problem client. When you do that over a period of time, I'm telling you, there was a time in my journey, my road to recovery, where nurses were not my favorite people. Like, I'll just be honest, I was so mad. Like, I even started telling them that, like, I will sue them, I've taken note of their names and all that, all because some nurses didn't want to offer empathy and help to me when I was going through my challenging time. Sometimes they even forget the reason why they are there. They forget that you actually signed up to be a nurse, and this is part of your responsibilities and it's part of your duties. Trust me, there are also some very good nurses who have actually offered me empathy, listened to me, pay attention to me. And I remember this one time when I had a reaction to a particular medication. I don't know the name of the medication. And it made my neck, like, my neck was stuck to my shoulder like this. Like, I couldn't move. And I was just drooling. And I was given a medication by one nurse, which didn't work. I ended up throwing up the first time, throwing up the second time. And then it looked like nobody knew what to do. And I remember a male nurse, he came to me and he told me, look, I'm going to give you an injection. It's going to really hurt, but I have a feeling that this is going to work and it will make you come back to yourself, and then the whole your head getting stuck to your next situation will stop. And I'm telling you, the moment I trusted him, the moment he injected me, even though the medicine felt like fire passing through my veins and it was hurting, that reassurance the nurse gave me before he gave me that shot, I just held onto it, and I just remembered, and that reassurance, it really lifted up my spirits, and I held on to it, and I was trusting and hoping and praying that I wouldn't die, my head would not get stuck to my shoulder and all that. So that kind of empathy he offered me, that sort of reassurance and all, it helped me in that difficult time. Because when you have, I don't know whether I should call it an allergic reaction or a side effect like that, you would think you are going to die. You literally think that you are going to die. It's not funny when your head is stuck to your shoulder and you can't move, your neck is just stuck. But that kind of empathy went a long way to help. I also have heard of instances where some of my friends who also have lived experiences with mental health conditions will tell you that nurses just did stuff to them without asking, like, oh please, can I do this for you? It was just like you were coerced, you were forced, you were held against your restraints, you were treated without dignity, not realizing that you are a human being, you have rights. Even like it's just because of one situation or another, that's why you are within their care and they need to treat you right. I've had friends who have had very nasty experiences with nurses because they just feel like, oh, I'm the boss, you are my patient, and I can do whatever I want to do to you and nobody can do anything about it. That's completely unfair, and I would like to encourage every nurse out there that if you know you are really pissed off or you are fed up with your job or something, maybe you should take a break or go for therapy or something to go and just recharge, rejuvenate yourself, and remember why you chose to be a mental health nurse, because there are so many types of nursing jobs around. You chose that particular field for a reason, so don't come and just hurt somebody because you are hurting. And of course, hurting people will always hurt people, but please just know that if you don't go and get your care and you come and hurt someone, you are actually impeding that person's progress and road to recovery, and we don't want that. Dear mental health nurse, acknowledge how I feel and how I would like to be supported. Yes, how I feel. Sometimes I've just noticed this thing about nurses where when they take care of you, like patients, for a very long time period, they just become so numb to your concerns, your pain, your struggle. It's like they become, what haven't we seen before? Like, we've seen worse cases than yours and they recovered, so what's your problem? And you, the patient, is like, I know you have seen worse cases, but mine, like what I'm telling you, I just feel like if you are a mental health nurse, you shouldn't be numb to like patients, their pains, their struggles. Don't treat every patient like how you handled the last patient. If it was a good thing you did, fine, maybe you could reapply it. But if you know that someone is genuinely voicing out their cares and concerns, please acknowledge it. I have been in situations or in circumstances where I felt like the nurses just, they don't care about me. They don't, like, it's like maybe they'll even talk about me to another nurse that I'm a problem, and that other nurse comes and is acting some way. I just feel like if you would treat someone like, I tell you something, you actually listen, it will go a long way, because it's team effort, collaborative effort, and you have to try and remember that the person you are seeing in the ward or the OPD or consultation room, I can be much more. Last week I said I can be much more than you think I am. Sometimes nurses treat you, I hate to say, but sometimes I've had nurses treat me like trash. Not like the treasure that I am today, but like trash, all because it felt like, oh, I did not look maybe a certain way at that time, or maybe I'm annoying them or something. They just take out all their anger and all their frustrations on you, and then at the end of the day they expect you to be chill. They expect you to come. You can't come and provoke me, a patient or a client, and you wouldn't get a certain type of reaction. I hate to say it, but it's actually the truth. I've had like nasty experiences with some nurses, and after that, like, what they didn't know was that I actually started carrying that pain, and now I wasn't looking forward to review appointment. Even like when I go for the review appointment and I see them there, I will get so mad and so angry, and I knew that what was happening to me was toxic and I needed to deal with it. Personally, I dealt with it. But how many people will have the strength and the courage to deal with that, in addition to their struggles in their mental health journey and all that? You don't want to add fuel to the fire. So please, 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 please try as much as possible to be nice and acknowledge people's feelings and communicate. Sometimes, like, I feel like sometimes nurses just, they don't communicate. They just do things to you without even realizing that, oh, you are actually a person, like you are a human being. You need, like, the way they are, you are like that. They just treat you like you are a thing, and it's so not right, and it's not helpful. And nurses, they actually spend more time with the patients, and so if I'm spending more time with you and you are treating me like I'm crap, and I am actually turning out to be crap, you shouldn't be surprised. The energy you give is what I ended up becoming. And patients and clients, I know sometimes we can be very difficult, challenging, and all that, but I feel like that's where communication comes in. You talk to me, I talk to you, and let's like treat each other with the dignity and the respect that we all deserve. So thank you so much for watching. I'll see you in our next video. I think I would want to show another video which is not related to the series. My last video that I'll release is an open letter to psychologists, but I think I'll post that one next 2 weeks. But for next week, you will have something else, which is June. Because this is the month of June, I want to talk about something new before we continue with our series. Thank you so much for watching. Make sure you share, you like, you subscribe. Bye.